My name is Tim, I'm 62 and my aim is to ride the K2 around the Coromandel Peninsula in New Zealand. It's one of the biggest bike races in the Southern Hemisphere.
I'm Jenny, I'm 54 and now that I've had a liver transplant I'm hoping that I can get back to water skiing and cycling.
Hi, my name is Vito. I've just turned 60 and my goal is to walk my daughter down the aisle. Yes, I got, after I was diagnosed, I got called in to meet up with one of the specialists at the Alfred Hospital, and I decided not to take anyone with me because I wasn't sure what it really was about. So I went in there on the 23rd of December, and they produced photographs, and I met with the surgeon, and he told me the news that my liver, there was about 3 or 4 cancerous, so full of it. And then he showed me the diagrams. We had a bit of a talk, that type of stuff. It was very quick, and that's when it was, on 23rd of December. I was a little bit angry, purely because of the fact it was 2 days before Christmas. So I decided not to tell anyone because I didn't want to spoil their Christmas activities or Christmas spirit. So throughout that whole holiday period, I think it's about 10 or 12 days, I had that information internally by myself and no one knew. As the days went by, I did go into online and I did try and seek some information, but it was all of that came after the Christmas festivities. Then when I did tell my family, that's when a few of my daughter especially got into it and started to help me through stuff.
I'd been sick for about 12 months previous to that, and I'd gone to my doctor and she'd sent me for a scan. I went back to her to get the results of the scan, and yeah, she told me that I had liver cancer. Oh well, at that stage, no, sorry, they didn't know what type of cancer I had. I had to go to a specialist to get the proper diagnosis. But yeah, it was pretty scary because I had a really large tumour.
My liver specialist delivered the diagnosis, and it was delivered over the phone while I was at work, which it may sound a bit brutal and a bit sudden, but we'd actually communicated quite well up until that point, and I was pretty sure I knew what was coming anyway, so that was okay. Went home and told Diane about it. Yeah. She was also aware of what was going on and aware there was a very strong possibility at that stage. I mean, I'd been to the point where I'd had to go into hospital and have a biopsy, and so of course we considered the possibility that it was going to be a positive return, which it was. After
they did the biopsy, I think it was about 3 days after they did the biopsy, the results came back that it was liver cancer. And there was a liver surgeon at the local hospital, so he came and spoke to me and told me what type of cancer it was, and what he sort of recommended was the best, because my tumour was so large, he recommended that surgery was really my best and only option. And I just had to go with whatever, what he thought. Yes, I didn't have time to sort of seek second opinions. It was a matter of get me into hospital and get the tumour out as soon as possible.
When you get the diagnosis, it's a very confronting moment, even though I sort of took it in my stride at the time. You sort of, over the next few days, you process that information and you start to think about, well, okay, the reality is I could die any time. I could walk out of this building and get hit by a train crossing the train tracks, or hit by a truck on the road, and I could die. People die every day. But what it does for you is it brings the reality of death much closer to you, and you have to reset a little bit, I think. Before the diagnosis, you sort of think, there are things I'd like to do, but I'll get to them one day. Once you get the diagnosis, you think, now if I want to do that, I'd better start doing something about it.
What happened is that after about, I think it was about 2 weeks, 2 or 3 weeks, then we went back. I went back to see him, and I brought naturally the whole family. The three of them wanted to be there as well, and that's when all the questions were asked by my daughter and my brother and my sister. I'd lost, And so they asked the surgeons lots and lots of questions, and I just sat there and just listened, and there were some good things that came out on that. There's some opportunities. So there was treatment, and there was 2 or 3 different types of treatments that they were going to do, and so therefore there's a little bit of hope and came into it. Yeah. So we're in the surgeon's room, and he let us know what options were available, and actually the treatment. But like I said, I couldn't be operated on because the tumours were too big and there's a lot of damage to my existing liver. So the only options available to me were chemotherapy or transplant. But transplant would come down the line. That was the option number 3 or whatever, number 4. So the initial treatment, it was to have treatments of chemotherapy, and so so we decided on that, and a date was booked for my first one.
Originally, I had no options, so surgery was the only option. After that, when the cancer did return, I went to an oncologist and spoke to an oncologist because, again, surgery was suggested, and I was just a bit worried about whether I should have a second surgery, and spoke with him, and he thought that was my best chance of a cure. So, yeah, after talking to him, I decided to go ahead with the second surgery.
I felt the decisions about my treatment were largely inevitable. I didn't, because I'm a person who tends to place faith in the doctors that I see. It's not that I'm unquestioning, but the treatment seems to have gone in fairly logical steps, one at a time, and I think it seems to me that we've taken at every step along the way what was the next logical step. I don't feel I've been rushed into it.
Having my partner Joe there for all at the appointments and scans, I tried to write down things, questions to ask the specialist and that, but a lot of times, I couldn't think of things. So Joe always sort of, thought of anything that I didn't think of, and and she was sort of there mainly as support, but also sometimes it's really hard to remember and let everything sink in that you're being told. So it's nice to have someone else there to, to listen and, anything that you've forgotten, remind you.
My attitude was always one of move on with it, that it was something that had to be dealt with, and it would have to be dealt with as quickly as possible. But at the same time, I was determined not to let it take over my life. And this was confirmed for me later on when I actually did the 2-week lead into what they call the transplant workup. 2 weeks of tests and being pushed around, and at the time I really, by the end of it, I felt I had to really just grab hold of myself and decide I wasn't going to be a patient. I would do the things that were necessary, and I'd follow the instructions of my doctors to the letter. But I wasn't going to let that be the dominant force in my life. That I had to maintain the other things in my life. I didn't want it to become all invasive, all pervasive. I wanted it to be just another part of life that I would have to deal with.
Well, I've had 3 liver resections in that 3.5 years. The hospital that I was going to, I was sort of becoming beyond their expertise, I suppose. So I was referred to the Austin. When I was referred to the Austin, they then took over my treatment, and after the second surgery, they found another 2 tumours about 6 months later, and they got one of the tumours with that, but the other tumour they couldn't get, so then I had to have a third surgery. So I've had 3 surgeries and then the TACE to try and get rid of the cancer.
I had three separate treatments. I think there are 2 different types of treatments. So that went on for, I think it was every 3 months. So about 9 months. I've had 3 treatments. The first treatment was nearly successful. And I think most tumours were destroyed. The second treatment got rid of all of the tumours, and so we celebrated, and then it came back, and then the tumours came back more so. And then that's when the surgeons, we had a meeting, family, that's when the surgeon said, look, you know, we need Vito to put you on the transplant list. You don't have too many options available. And that's when the family, especially my daughter, you know, sort of convinced me that I need to go on the list.
When I first saw the people at the Austin Hospital, the head surgeon there, he thought they would be able to just surgically remove the tumour from my liver. As it turned out, my liver was in too poor a condition to put up with that, anything that invasive. And so what was recommended was chemoembolization, which is targeted chemo, the TACE therapy, where they inject the chemo directly into the tumour in the liver. So I've had that therapy 4 times now. It's been progressively affected me more each time. Each time I feel progressively a little bit sicker for a little bit longer after the therapy.
I had to go into hospital for some, I can't remember what it was, but I had to stay overnight overnight at the hospital, I suppose. And there was another guy there, and we just, you know, I said, yeah, he said, hi, how are you, and all that type of stuff. Started to talk, and then he told me that he was there for a checkup, and that he got a liver transplant about 15 years ago. And he looked really, really good. And he started to talk to me for at least half an hour to an hour, telling me all the things that he was doing, playing golf again, and, you know, his whole story. And I just said, you've got to be joking me. Wow, you know? And that's when it all changed for me. You know, that moment was just, you know, was God sent, you know?
Sought support from my GP, I suppose. Talked to her about, you know, my treatment and my options, and also after all the surgeries, I went to physio quite a lot because I had, you know, a lot of back issues after the surgeries, and just the only other support that I sought was a dietitian, just to sort of talk to her about, you know, what was the best way to go about, like, keeping myself as healthy as I could, you know, with my diet, and listening to music. That was really helpful, and walking our dogs. Tried to walk every day, and I tried to sort of walk about 5 kilometres every day. If it was too hot to walk to the dogs, I'd go walking on my own, just to try and keep fit and, you know, keep as well as I could.
I've found it's really important to set some goals for myself that have nothing to do with cancer, that are things that I would like to do, and to set those goals and try and work towards them, concentrate my mind in that direction. And I can in that way I can follow the doctor's advice, I can do the treatments and stuff, but once I'm finished with that, I'm back in my life again.
There were some nice moments for me where I did attend the forums that were available to me, made available to me. And there's a lot of people in the rooms that were going through the same position as me, I suppose, pre-transplant. So we did, you know, like a round circle, circle. And that was really, really good for me too, just listening and just listening to other people sharing their moments. And that's when I started to, you know, think, okay, well, I need to work on myself a little bit more. I need to start to talk to people. And that was a really good moment for me. And in that group, there was a lot of mention about, you know, doing physical exercise and getting out there and doing and being active, walking, you know, playing golf, whatever it is. But your body needs to, you know, to get out of the room that I was in. So, you know, that was really important to me.
Like, I saw a social worker as part of the pre-workup, and she was sort of saying to me that you can get a parking permit, a pass to, you know, to make parking a bit cheaper at the hospital, and also that you can claim travel if you're over 100 kilometres away from the hospital where you're receiving treatment. So that was really helpful to get that assistance. Yeah.
Look, I mean, I made so many mistakes, you know. The mistakes I made were I didn't share my story with anyone. I isolated. I allowed myself to get into dark places, and that's something that, you know, if I had it all over again, I wouldn't do. You know, I needed to, and I didn't, but I needed to, you know, to talk to people. I need to share it. And I need to get a lot more spirituality in my life as well, meditation and all that type of stuff. You know, all the good things that I need to do, I didn't do. You know, and it was just difficult for me. But, you know, had I tried a little bit harder, I think I could have done it, and it would have been, and the journey would have been a lot easier. You know, a lot easier. So, you know, you know, if I was speaking, and I do speak to other people in similar circumstances, and that's what I say to them: talk to someone, you know, and share your story, you know, and because there's lots of people out there that they're in the same ride.
Having goals, having things that I want to do, and knowing what those things are, and wanting to get back to doing them after the treatment, wanting to be able to finish the treatment and then concentrate again on the things I wanted to do, and that's putting aside all the, you know, the family support and things like that, which of course they've all helped, and friends and work colleagues. But yeah, the main thing is just being able to focus on the future and focus outside the diagnosis.
I think little things, you know, that used to worry you, or that used to seem really important, you know, sort of insignificant, like, you know, when you get a cancer diagnosis, yeah, like little tiny things, you know, you really don't put any sort of thought or stress into those sort of things. You know, you sort of got to look at the big picture, and yeah, it changes you a lot. And family and friends, you know, become a lot more important. You sort of realise that, yeah, without them, it's really hard to get through something like this. Just to stay positive, you know, and stay strong, and don't give up hope, like, and rely on other people for support, like, you know, whether it's your partner or you know, main carer or family or friends, because yeah, you really can't do it on your own. It's a big thing. Being diagnosed with cancer is there's no trivialising it. You know, it's a major occurrence in your life. It's a major event, and so of course it's going to have an effect. But as with anything else, if you can try and draw something positive from it, then it can only be helpful. And if I just refuse to let it get on top of me. I refuse to let it be the big thing in my life. It's not the big thing in my life. It's just another thing in my life, and I have to deal with it, and the same as I have to deal with other things, you know. I have to put out the garbage at home. I have to go and have my cancer treatment.